Hello, everyone. Thank you for joining my pain management series that I'm joined with Dr. Kavita Gupta, who specializes in physical medicine and rehabilitation and is affiliated with many hospitals in Southern Jersey and Philadelphia. Today, I'll be talking to you on knee and hip pain management. So very important because a lot of us don't know what's causing that pain. Could it be inflammation of the tendons or the joints? Could it be tendonitis or bursitis or meniscus tear? Or is it coming from the hip? Share with us how we can address knee and hip pain, and are they connected?
Absolutely. Many kids, when they grow up, they see the skeleton body. And when they see the skeleton body, there's a song that the ankle bone connected to the knee bone connected to the hip bone. And that is really what it is. I mean, my background's in engineering. So, mechanical engineering, biomechanical engineering. So I see the body as a mechanical system, as we should. The body has a whole mechanic system. So if one system goes out of whack, it can affect everything else. It's a cascade. So oftentimes the source of where you're feeling the pain may not be where the pain is. So oftentimes when we're feeling the first thing, if you're going to feel pain, you're going to notice that you can't do things. You can't, especially if we're talking about knee and your hip. You can't walk, you can't climb stairs, you have trouble getting in and out of a car. If these are symptoms that you notice, those are probably coming from these kind of joints, because those are the joints that are attributed to getting up out of a chair, getting in and out of a car, climbing up and down stairs. And when we see people having difficulty with those things, those are kind of sometimes the first thing we think of, that it's a joint. And they'll clearly tell you that, well, it's in my joint, it's in my knee. And a lot of times, knee joint pain. Let's talk about the knee specifically. The knee, when you're going up and down stairs, or when you're going a certain amount of distance, or you feel clicking, or you just feel that morning stiffness. People say, I feel it as soon as I get up in the morning, or I feel when it's going to rain that my knee hurts, my joints hurt. These are very common sort of things that people will say to me, and it's because the pressure in the joint increases, especially with weather and with ambulation, with walking. You're going to notice these simple type of arthritic type of maladies or pain symptoms that patients talk about, especially for the knee.
It could be osteoarthritis.
Exactly what it is. Or it could be, it depends. If it's something like, I look at the age of the patient, what age range, not a 20-year-old, 25, 20 to 30-year-old person coming into my office with sudden knee pain. It's very unlikely I'm thinking of some really bad arthritis. It's going to be some sort of acute injury, maybe like a tendonitis, or maybe a tear in the ligament or meniscus. That's more of an acute injury and more likely in that age group. Someone in their early
How about
50s.
bursitis? Could be also one of the causes.
Absolutely. Definitely. If they're kind of doing repetitive type, if they're a runner, or if they're doing some sort of thing that requires them to go up and down steps, or, if they're bending at their knees frequently, those type of things, frequent type of repetitive motions that affect the knees, can cause a bursitis, can cause a tendonitis. It can cause fluid in the knee to accumulate. So that's like a gradual, progressive type of thing. Sudden impact, sudden injury, a fall, trauma, or sports can be something more that we would have to investigate, to look at X-rays, MRIs, and things like that, exam, and see if there's something more that may need surgery. But the common day-to-day knee pain that without any sudden injury is more than likely, some sort of fluid, or just sprain and strain, or even arthritis. And, how we can prevent it. Sometimes, like I said in my previous talks, that sometimes good genes, or parents, we can't thank them enough for the things they give us, but sometimes genes of arthritis get passed down too. So we can get early arthritis from genetics too.
It's a
So
warning signal. If you can walk, that's okay. But if you're climbing up the stairs, your knee is kind of buckling.
Yeah, you're going
It's
to notice
phenomenal.
weakness. You're going to notice sudden weakness. You're exactly like what you said. You're going to have knee buckling. There's going to be the sudden ability you can't lift up your leg. So what happens is when the knee is becoming arthritic, it's
Mm.
kind of use it or lose it phenomenon. If you're having pain in the knee, you're not going to want to go up and down stairs. So what happens? If you're not doing stairs, you're not using your muscles. If you're not using your muscles get weaker. So you're going to all of a sudden get weaker and weaker, and all of a sudden the knee muscles get weak, and then you feel unsteady. You lose your balance. You could fall. Your knee could buckle. And then people start using canes. So it's that phenomenon of use it or lose it type of thing. So how do we kind of prevent it? How do we keep these sort of things? You need to keep your muscles engaged, doing gentle exercises, not strenuous, but gentle walking, light weights, keeping some sort of routine in your day-to-day activities. If you have instability in your knee, a doctor would probably recommend a brace. It may recommend therapy to strengthen all the muscles in the knee, all the muscles that support in the thigh to prevent the knee from buckling. So that's something the patient, and the physical therapist would have a conversation about what can we do to make that person stronger. Obesity, weight is a big factor for knee pain. Added weight on the body will cause a lot of problems because it's putting a lot of stress on the joints. People say, "Well, Dr. Gupta, I can't exercise. You're overweight. I have knee pain. How do I exercise?" That is a catch-22. It's very difficult. So there's diet modification, trying to do some cardiovascular. You could do hand bicycle type thing to build your heart rate up. There's different ways we can come up with a creative plan to help lose the weight so you can kind of take the stress off the knees, bracing of the knee, even modalities, using things to help with the knee bracing, compression units, devices that we can send the patient home with to make their lifestyle a little bit more comfortable.
So home care would be compression units, could be cold and hot packs.
Yes. With cold is oftentimes used in an acute injury, like if you
Yeah.
suddenly get hurt, a sprain and strain. So cold is definitely a very good thing to use. And people find good relief with cold, and even heat can be used for the musculature to get blood flow in the area. But we have to use these things in caution because cold and heat, if you're diabetic, and you don't have very good sensation, if you're losing nerve sensation, you don't want to put something too hot, too cold because you could end up with a burn. So we have to also caution to make sure that patient is using these things safely. Into my office with literally frostbite burns or burn marks on their bodies because they're using heat directly on the skin, and they're overdoing it, and they're doing excessive amounts where they actually end up with burns. So it has to be done, with direction and time limits, so patients are advised how to use these things. These things knee pain can also be managed with different things like injections, topical medications. Injections is not a bad thing. Injections are safe. Injections can get the inflammation down. These are all very, very common steps before surgery. If surgery is not an option. Even regenerative medicine. I do a lot of regenerative medicine. So PRP, there's stem cells. These things are all the new cutting edge type treatments where patients can kind of use these as an option if they don't want to get steroid injections. But there's a lot of different options.
And you can't do anything with self-care or physical therapy or heat and cold compresses. And when the doctor said you need a knee transplant, can regenerative medicine help at that point of time?
Regenerative medicine can help, but it's not going to replace the concept of if you have bone on bone, where the bone is literally grinding against the bone, creating like that arthritic. There's no gliding phenomenon left in the joint space. So regenerative, it might be beyond the scope of regenerative medicine. We're looking at regenerative medicine probably in the moderate phase before it gets so bad that surgery is the only option. But there are those patients who are very older, and they have other medical problems that they can't have surgery. So, and family members are very concerned. They want to do something to give them relief. So in those cases, yes, it can be an option, but it may not be an option that's going to be completely resolution of all their pain. It's going to give them some relief, maybe not all.
And we've always emphasized in our shows and this pain management series about lifestyle modification. And we talked about it. You talked about overweight going to be, it only exacerbates the issue. So proper diet, proper exercise, relaxation, meditation, all to calm you down. And again, first line of treatment is prevention. So, and early intervention. So those are the two key takeaways.
Absolutely. I mean, you don't want and another key takeaway on this is, especially with pain is kind of like an alarm system for your body. Okay, in the beginning phase, you're doing all the things that you mentioned, prevention, you're kind of nursing and babying and taking care of the problem. But there's a time limit to which you cannot let it go past. You should, at some point, at probably a 6 weeks, or even depends of how, if it's getting progressive, maybe sooner. But if it's not resolving, you really need to have a doctor involved in your care. You cannot manage this yourself. If it's in within like 4 weeks time and there's resolution, the pain is subsiding and you're seeing improvement, okay. But if there's no resolution, you need somebody involved, and you need a director to kind of oversee and see if there's studies needed, other options, other things that you might not be able to think of or do, because a lot of people are now getting a lot of information on independently, and their self-care is like self-driven. But you can't do that completely. You need the physician to kind of help coordinate some of that.
Do you see a lot of your patients for the HipPain, and what has been the success rate with your self-care treatments as well as physical therapy?
Motivation. Patient has to be motivated. There was a time, yeah, I mean, there was a time when patients would come and they would just want a pill and said, give me something to fix it. And that's not the magic bullet treatment. It's a comprehensive treatment plan, which includes therapy, medications, rehabilitation, maybe alternative medicine, mindfulness, diet. All of these things are a combination of everything to make the outcome successful. You have to do a little bit of everything. There is no one shotgun treatment. Yes, you could accelerate things with maybe an injection. You can add a pill to accelerate things, but not one thing is going to solve the problem.
The best is to integrate all these treatments that we're talking about, have a holistic approach, and see what happens after that.
Yeah, well, that's what it is. Holistic and kind of being open-minded and having, faith in the system that, rehab alone will not fix it. An injection alone, like you can get an injection today, but then you could be, doing all the wrong type of movements with your body and not really paying attention to how you lift and how you bend and how you do things. But, you have to maintain a certain protocol after you do these things. Like, you could do a 4-week diet and then you could gain all the weight back. It wasn't successful. The whole idea is mindfulness of eating the right foods and doing the right thing. So it's that maintenance of that. That's what the key thing is. So joint pain is something that is a reminder that you can manage it to a certain extent, but you shouldn't ignore it. You need investigative studies. You need therapy, the exercise, the medicine, injections. It's a whole thing. So someone shouldn't give up thinking that you have to live with this. There are ways to manage it, and that goes for knee and hip. Hip is a whole different. It's not very far from a knee pain presentation. Hip is a little bit more complex than that. it's a bigger structure, and there's a likelihood that you could fracture the hip, which would mean that you could end up with a hip replacement, and hip replacements have complications. And that those complications could be, in some situations fatal. And we don't like to say that, but there are those type of risks that are involved. So, and that happens in the older population, and that's when people are sicker. So how do you prevent that? Osteoporosis is the number one reason why someone could probably get a hip fracture just, from trauma. Falling, an elderly woman who has osteoporosis falls, likelihood of getting a hip fracture is very high. So making sure they take their calcium, making sure they're doing proper exercise, making sure their balance is okay. That all comes in prevention. So it all comes back to like maintaining some sort of
strengthening your bones and joints, taking good supplements, that also adds on.
100%.
Well, thank you so very much for being part of our pain management series, Dr. Kavita Gupta.
It was a pleasure. Hopefully everyone had some good insight from some of these topics that we discussed. Thank you so much, Renee.
Absolutely. And I'm Dr. Renee. Stay healthy, stay positive.